neurology, physiology and anatomy, the ventricular system, and the rule of fours. All right, so for the ventricular system, all I want you to know right now, before we get to any pathology, is just in the anatomy in which the CSF flows. So it starts with the lateral ventricles, where the CSF is made by the choroid plexus. It's honestly made in the lateral, third, and fourth ventricles, but who cares? Let's start with the lateral ventricles, okay? And the CSF is going to flow from the lateral ventricles through the Monroe into the third ventricle. It's going to go from the third ventricle into the cerebral aqueducts to the fourth ventricle, okay? And what they want you to know is that the cerebral aqueduct can get blocked by some type of inflammation and some different types of pathologies, which we'll talk about later on, and that can lead to a non-communicating hydrocephalus, okay? But overall, it goes lateral to third and third through the cerebral aqueduct to fourth. That's the highest yield thing. It will all drain and be reabsorbed into the arachnoid space. Next is our rule of fours and how it relates to the brainstem. So what they love to ask you, okay, is about the cranial nerves and the brainstem. What I want you to do again is take a look at the brainstem, whether it might be an anatomy view of the brainstem, like a gross anatomy view of the brainstem, or a diagram of the brainstem, because they will show both of those on the MBMEs, okay, as well as your actual exam. They love the photos of the brains, okay? So look up the brainstem, gross anatomy, and diagram, and make sure you're able to identify the cranial nerves at each level, because they will ask you, they will have arrows pointing at a bunch of different cranial nerves on the brainstem, and they will ask you which one they're talking about within the actual question, okay? So let's start with the rule of fours. Cranial nerves 1 and 2, all right, not associated, all right? Cranial nerve 1, olfactory, and cranial nerve 2, the optic, that's located away and not on the brainstem. So let's start with 3 and 4. So 3 and 4 are located on the highest part of the midbrain, or the highest part of the brainstem, which is the midbrain, okay? Next is going to be 5, 6, 7, and 8. Those cranial nerves are on the next lower portion of the brainstem, and that's the pons. And then we have 9, 10, 11, 12, which are finally located at the lowest portion of our midbrain, known as our medulla, okay? So another aspect, that's the rule of fours, right? So that was the first part of the rule of fours. The second part of the rule of fours is that you have any type of number that goes into 12, that's a factor of 12, okay? That is going to be medial, okay? So cranial nerves 3, 4, 6, and 12, okay, are all leaving the midbrain medially, okay? Very, very, very important to understanding the rule of fours. The rest of the cranial nerves are going to leave laterally, okay? So that's another key aspect of the rule of fours. Make sure you understand this, okay? Because that's going to give you so many questions that you might not think so will help right now, but that's going to help you a million times over. You're probably thinking to yourself, Nate, do I need to memorize any of the myelin staining, the brainstem cross sections with the myelin stains that we learned M1 year? Nope. Don't think about those. The rule of fours is all you need to know, okay? Understanding where they're located on the brainstem when it comes to gross anatomy or when it comes to diagrams is very key. So understand your rule of fours and you'll be good to go, okay? And so now that we're talking about the cranial nerves, we'll talk about where they leave from the skull, okay? And this is very, very important. They probably asked every single one of these, so you have to know them. The first one is going to be the cribriform plate. Cranial nerve 1 leaves through the cribriform plate, which is located obviously near the narians, right? It's near the nose. That's where we get our smells from. Cranial nerve 2 is, once again, the optic nerve, and it's going to be through the optic canal. Relatively easy, correct? Cranial nerves 3, 4, 5, 1, and 6, okay? So 3, 4, V1, and 6 are all going to be leaving from the same area known as the superior orbital fissure, all right? V2, or 5-2, is going to leave via the foramen rotundum, and V3, or 5-3, is going to be leaving the foramen ovale, okay? So remember all of those, very key to understanding or getting essentially all the questions right. They love this memorization. Remember these, okay? 7 and 8 are going to be our internal auditory meatus, right? 9, 10, and 11 are the jugular foramen, and 12 is going to be the hypoglossal canal. You have to memorize these, okay? I know it's going to be pain, but once again, it's easy points. It's such easy points, okay? So remember that all of these, I should probably honestly go through it one more time. CN1 is cribriform plate. CN2 is optic canal. Cranial nerves 3, 4, 5, 1, or V1, and 6 are all going to be superior orbital fissure. V2 is foramen rotundum. V3 is foramen ovale. And then 7 and 8 are going to travel together through the temporal bone in the internal auditory meatus. That's where they leave. 9, 10, and 11 are jugular foramen. And then 12 is our hypoglossal canal. Okay? So remember those exits and entrances. Lastly, while we're talking about the cranial nerves, I probably should just go through the pathologies of each one. So to remember whether one is sensory or motor or both, there's an easy mnemonic. Some say marry money, but my brother says brains matter more. Okay? Big brains matter more. Okay, so some say marry money, but my brother says big brains matter more. Okay? So I messed that up for the first one, but some say marry money, but my brother says big brains matter more. And that's how you know whether something is sensory, motor, or both. Okay, starting off with cranial nerve 1, this is olfactory. This is what gives us our smells, okay? Optic nerve number 2, this is our sight, okay? Both the optic nerve and the olfactory nerve, CN1 and CN2, are not in the brainstem, okay? Next is our cranial nerve 3, our ocular motor. Damage is going to cause a down and out look of the eye, so the pupil is going to be facing downward and pointing outward, okay? So that's when you know you have damage to the ocular motor if you see that type of physical exam on the eye. And then it will also cause ptosis, okay? So keep that in the back of the mind, okay? Next is the trochlear nerve, CN4. Damage to this causes an inability to look downward. So they're going to say patient has problems maybe reading because they'll look downward when reading, or going downstairs. They have troubles with that. That's talking mainly about damage to cranial nerve 4. Next is cranial nerve 5, our trigeminal nerve. Once again, the trigeminal is going to give us sensory to the face. So you're going to have a numb face, an ability to feel anything on the face if you have trigeminal damage. And the next one is going to be abducens, which is cranial nerve 6. This is when you can't move your eye laterally. So if you have an inability to move your eye to the lateral aspect, you know that it's cranial nerve 6 damage. All right, 7 is facial nerve. The facial nerve is probably the highest yield one that they love to talk about because it can be injured in many aspects. They like to ask about it being injured during parotid gland surgery because the cranial nerve 7 travels near the parotid gland. And whenever it's damaged, it could lead to Bell's palsy, right? So that's the drooping of the face. And we'll talk about Bell's palsy in more detail later on in the pathology section. But it also can lead to hyperacusis, okay? Because the stapedius, which is a muscle in our auditory system, is innervated by the facial nerve. And so what the stapedius normally does with the help of the cranial nerve 7 is that it will pull off our bones in our ear, our middle ear bones, from the tympanic membrane so that we don't have as much vibration during times of when we're talking or when we're coughing or when we're eating, okay? But since we have cranial nerve 7 damage, facial nerve 7 damage, the stapedius can no longer do its job. So you start to hear things too loud. You can hear yourself eating. You can hear yourself talking more, okay? And that's hyperacusis, okay? So that's a question that they like to ask about. Next is the vestibulocochlear nerve, cranial nerve 8. This is going to be presenting with tinnitus or hearing loss or nystagmus, okay? That's damage. It can cause nystagmus or hearing loss and tinnitus. Glossopharyngeal cranial nerve 9 is going to be loss of gag reflex, okay? And it also can cause loss of sensation and taste in the posterior 1/3 of the tongue. Because remember, we talked about that posterior 1/3 of the tongue is completely both taste and sensation from cranial nerve 9, okay? Next is the vagus nerve, cranial nerve 10. This is going to lead to hoarseness, dysphagia, and palate collapse, okay? And then the accessory nerve, cranial nerve 11, is that you have an inability to turn your head or shrug your shoulders, okay? Because it essentially innervates the trapezius, okay? So you have loss of function there, and you can't shrug your shoulders or turn your head. And then lastly is cranial nerve 12. You have an inability to protrude your tongue, and the tongue protrudes to the ipsilateral side, okay? And then what I want you to take away from all of those is just damage, because they're going to ask you about all these different types of damages. And so that's why I ran through what happens when each one of those is damaged, okay? The last thing is cranial nerve reflexes. The cranial nerve reflexes that you should know is the corneal reflex, which is coming in is V1 and leaving is 7. The gag reflex is coming in, the afferent, is 9 and leaving is 10. The jaw jerk reflex is both trigeminal, okay? And it should not be present in any of us. It's usually pathological. It's not physiologic, okay? And the pupillary is 2 afferent coming in and 3 efferent leaving, okay? So that's pretty much all for the cranial nerves. I know that was kind of a long section, but I think it really encompasses the point of the cranial nerves within the neurological system. Be sure to understand this process in this specific video, because a lot of questions later on stem from the understanding of what's going on here at the cranial nerve sites, okay? If you have any questions, once again, please reach out.